Now, many confusion arises, especially with the excision, because I've dealt with so many dermatologists. It's really a confusion, why? Doctors don't document the way that we need. We should always understand a provider's way of treating is different and the documentation is different, right? Because they treat differently, each one has their own thing, but our coding rule has only these set of ways. Because coding, the code sets are classified mechanically or with some purpose. I don't think it falls exactly on the lines of practice or clinical practice, right? It differs. That is why doctors also keep documenting in a different way. But for the coding perspective, what is needed is we need to know the diameter of the lesion that is being excised. What is the diameter of the lesion? So, while the doctor is going to remove the lesion, the physician is also going to remove some normal tissue around the diseased tissue. For example, there is a suspected tissue which is of 2 centimeter. Okay, you can see which is of 2 centimeter, and this diameter the physician is going to excise a half a centimeter on margin. Margin means it's a normal tissue. It is not subjected to the disease process. So, when the physician is going to remove the diameter of the lesion plus some margins, your coding should be the sum of the diameter of the lesions plus the margins required for a narrow excision. That means, say on one side the physician is excising a half a centimeter of margin, on the other side he is doing a 0.7 centimeter of margin. Emphasis need not be given for this normal tissues. Our concern is only the diseased tissue, right? So here we'll have to consider only half a centimeter. In a nutshell, you need to know what is the total length of excision. You don't worry about the diameter or the margins. See if the documentation tells you what is the total length that has been excised, take that code. Here the diameter is only 2 centimeter, but when you add the margins, half on each side becomes 1 centimeter, right? So 2 plus 1 is 3 centimeter, so your code changes. Initially you might have taken 11402, but now you should take it as a 11403, right? Because what concerns us is the length of excision. That's it, keep in your mind. What is needed is the length of excision in millimeter or centimeter, but the code sets are given in centimeter. Sometimes doctor documents as 10 mm, which means 1 centimeter. So try to convert that, okay, clear. So after this excision, you need to know whether is it falling within the same group. You will have to code each for the excision separately. If it is even within the same group, say the doctor is removing a lesion on the trunk and also on the arm, you will have to report code separately. For the trunk, you will have to report what is the diameter 11402. For the arms, there is a diameter 11402. So report it separately because 2 lesions are treated. That's all. Just know the anatomic side and know the length of lesion or the excision that has been excised over. So same applies for malignancy as well. Okay.